Social determinants of health matter when addressing non-communicable diseases in the Caribbean because social determinants speak about the way that you live, where you work, how you play, how you age. And those are all relevant. So for example, if children are in schools and the only thing that they have to eat is unhealthy, fattening foods, then the children are going to get fat because that's the environment that they're living in. If people live in areas where there's not access to good education, then their educational levels are going to be lower, and we know that low educational levels contribute towards the lack of control of non-communicable diseases, as well as people having more of these diseases. So education, although it doesn't seem to be something related to health, education is very important for health status. So in the Caribbean, in order to address non-communicable diseases and the social determinants, it's very important for all sectors to be involved, all of society and all of government. So for example, we would like people to have access to healthy food. And one of the ways to do this is to engage with the private sector and see if we can work with them to make their products more healthy. So the Port of Spain team has been looking at the status of non-communicable diseases, has been looking at what the countries have been doing with reducing the risk factors and the social determinants. And we believe that in terms of accelerating action going forward, what we need to do is to engage with the sectors and to encourage them and to provide resources and toolkits and guidance and a way to reflect on what they're doing. And also, just recently, I was talking with the coordinators for non-communicable diseases in each country, and they were saying a simple thing. They want to have conference calls once every 3 months so that they can talk to each other and learn from each other. In terms of the role of all of government in advancing this, you remember that this all started with heads of government making a declaration in 2007. And just 2 weeks ago, they again addressed the issue of non-communicable diseases. And among what they said included doing things like raising taxes on sugar-sweetened beverages. And we believe that in general, it's going to take intervention at the Prime Minister's level for us to really get all of government involved in this, because the Ministry of Finance is critical in terms of raising taxes on tobacco and alcohol and other unhealthy foods, but that's not enough. The health sector wants some of that money so we can advance our health agenda the way that has been done in Jamaica with the National Health Fund. So we would actually like to see this throughout the Caribbean, where a portion of the money from these taxes is dedicated and earmarked towards health. So some of the lessons learned from the evaluation of the 2007 Heads of Government Declaration on NCDs were we need more political attention to NCDs. We need this attention to come from the top. We need to increase our attention in terms of getting results with regards to food in particular, and also the activities within schools. We found out that things that did work well were areas where there was clear guidance, a roadmap, and support from regional organizations. So for example, surveillance of NCDs, looking at what's happening and measuring the population levels, has been supported by PAHO, CARIC, and CARFA, and that has done well. Caribbean Wellness Day has been supported by CARICOM and PAHO, and that has done well. Framework Convention on Tobacco Control from WHO has done well. But in the areas where you don't have that kind of support and roadmap, it's more difficult for countries. I would like to appeal to the governments of the region to actually move forward with what needs to be done to implement what they have already committed to. The heads of government have made the commitments, but now we need to get the multi-sectoral and all of government and all of society response together with the necessary leadership and monitoring so that we can actually turn our dreams into reality.